Hi, Five Branches University students. This is Dr. Chi speaking. We're living in an unprecedented time, and many people are looking for ways to stay healthy and safe during the COVID-19 pandemic. But right now, there are unknown numbers of people in US that are suffering from COVID-like symptoms who are simply cannot get tested or tested positive, but with mild symptoms. So I know a lot of us already practice social distancing, and most people have already been following all the rules about hand washing, avoiding touching their faces, avoiding shaking hands or hugging, or disinfecting surface frequently. But is there anything else that we can do can help our body? So this video will teach you how to take care of yourself or your patient or your friends at home in self-quarantine, which promotes self-healing and reduce stress. According to the last videos, that this pathogen is invaded the Mo Yuan area, cause dampness in our body. Many experienced TCM doctors from China who have treated COVID-19 patients, they all believe that this pandemic belongs to dampness, and they call it Damp-E. E means epidemic diseases. The Mo Yuan is the area in between interior and exterior, or in the Shanghai Lun, we classify this as a Shaoyang level. Pathogen doesn't invade the exterior, so we cannot use only the releasing exterior methods that profuse sweating. And pathogen doesn't invade the interior, so we cannot use the purging method. Last class, we already talked about Wu is the first one who found that this pathogen enter the body through the mouth and nose and invades and linger in our Mo Yuan area. And he established a new method called Fenxiao. He used dispersing, transforming, and draining three methods together in one in order to get the dampness out of the Mo Yuan area. And he have used the spicy and warm aromatic herbs to accomplish this task. He uses Binglang, Caoguo, Houpo. Those herbs are moving qi, remove dampness, open stagnation, and promote urination. These kind of herbs can help to tackle the Mo Yuan area and get rid of the dampness in that layer. During the epidemic disease, tongue coating changes very fast and can promptly reflect the development of the disease and the condition of the body. They often found their tongue was really white and have a thick coating on top of the tongue. So we know that tongue diagnosis is one of the diagnostic tools that we use very often in our clinic. So today, I'm going to teach you how to use the tongue diagnosis. You can do self-check every day at home by looking at your tongue and change your lifestyle accordingly. Many COVID-19 patients have very thick, white, powdery-like coating. There are two patients in the early March with COVID-19-like symptoms that are helped with traditional Chinese medicine. On the top, the patient 1 presented with low-grade fever, dry cough, shortness of breath, and extremely fatigued with low appetite. So at the beginning, the tongue was really pale and the coating was very white. So after 7 days of using herbs, and then you can start to see that the tongue is improved by the color and also the coating. The color returns to pink and the coating starts to thinning up. The second patient in the bottom also presented with high fever, dry cough, sore throat, and chest pain. So after 7 days of treatment, the tongue starts from the white graysy coating and is much lighter white coating. The tongue colors from pale and start to returning pink. So all the symptoms are improved while the tongue returned to pink and thin white coating. In this slide, the two patients are diagnosed and hospitalized in China with COVID-19. The tongue is presented with very white, thick, graysy, powdery coating. At the same time, the CT scan also showed ground glass opacity, saturated with too long. And the second patient on the bottom is showing bilateral ground glass opacity. When they started to taking the herbal medicine together with Western medicine, you can see the tongue start from white coating, become thicker, and then start to thinning. The tongue reflects absorption of the inflammation in the lung. So what is dampness? Dampness seems to be rampant in industrialized society. It is due to the burden of unnatural substance in our food that need to be eliminated from our body after consumption. So eating a clean and whole food diet is so important for our body and for our immune system. So if patient presented with dampness, usually they will feel very heavy and it's very difficult to treat. Also lasts for a long time. It have a tendency to move downward. So a lot of the patients presented with COVID-19, their lung was being infected in the bottom 1/3. In Chinese medicine, dampness is considered to be the cause of many illnesses, such as high cholesterol, cancer, metabolic disorder, chronic fatigue syndrome, fibromyalgia, allergy, and an environmental illness. So we all know that in this time, for people who have a higher risk of getting COVID-19 are the people who are already have underlying medical conditions such as heart condition, diabetes, severe obesity, and hypertension. So all these are all classified as dampness body type in the traditional Chinese medicine. Environment is very crucial for the survival of a microorganism. One of the most central concepts of traditional Chinese medicine is that of the intimate connection between the body of a man and the environment within which man lives and works and play. The physiology of the cells, tissue, 脏腑 organs of the body is in dynamic internal equilibrium and constantly adjusts according to the changes in the external environment. So coronavirus transmits in the dampness microenvironment. According to the traditional Chinese medicine evaluation, it also makes our body damp. The patients who have COVID-19 usually presented with very white, greasy coating, and also body aches, heaviness, strong fatigue, loose stool or diarrhea, low appetite, etc. Those are all considered as dampness condition. If we can eat healthy and getting proper amount of exercise, keep our environment pleasant, our body have a power to recover itself. What are the lifestyle and practices that will cause our body to become damp, and then how to change them in order to provide a better environment for our body to recover? There's two things that we can do to fight this dampness. First of all, we have to keep our body's internal environment warm and dry. And second, we have to keep our external environment warm and dry. In our house, we can light the fireplace or turn on the heater. We also can burn moxa or dry sage around the living space in our house. And use moxa stick, cut them into small sections, and burn a section each time for patients who already have cold-like symptoms and then with white coatings in their tongue. And you can burn this moxa in the place where they stay in self-quarantine. That would be a very good way to change the microenvironment for pathogens to survive. How about our internal environment? If we feel cold or have some kind of chills, or if we already start feeling our achiness or soreness in our body or in the back of the body, we can drink a warm ginger lemon water and sit in front of the fireplace or any other heat source with back facing the heat until it starts sweating. It is a light sweat, the kind of experience when you drink hot soup or tea. Remember, it cannot be a heavy sweat like from a sauna or intense exercise. Lemon. Of course, lemon, we know that there's a lot of vitamin C, and vitamin C actually help to fight virus. Ginger can disperse lung cold and stop cough. It also releases the exterior and warm the middle gel. It helps to remove the dampness by warming our stomach and promote sweating. Because a light sweat will open the pores of the skin so that the lungs can disperse fluids and the fluids will not become pathogenic dampness. Then when we warm the middle gel, we can get rid of the dampness by transforming the dampness in our stomach. There's other ways to avoid dampness and phlegm in our body. First of all, we have to avoid overeating. In traditional Chinese medicine, we believe that overeating will weaken the stomach and the spleen and leads to accumulation of the dampness and phlegm. And excessive consumption of the cold energy and raw food will also weaken our spleen. Like for example, the refrigerated food, or ice water, or ice cream will cool our stomach and make our stomach not being able to move efficiently. Raw vegetable, salad, fruit are also considered cold and raw. If you already have COVID-19 like symptoms, you have to avoid refrigerated food and raw vegetable and salad if possible. And some other food are also considered as greasy and create dampness. For example, like deep fried food, like chips, cheese, milk, cream, butter, banana, fatty meats. When you wake up in the morning, meats are nuts, because nuts have a lot of oil inside. And then try to eat light is crucial during the time when you already have dampness in your body, especially in the tongue, that if you already see white coating in your tongue. So it's actually a good recommendation that you can, when you wake up in the morning, and then instead stand in front of the mirror and take a look at your tongue and see if your tongue is already covering with white coating. If you already see white coating, try to eat light, avoid sweets. Recommendation here is to take 薏仁 with 赤小豆. 赤小豆 is very good for moving the blood, at the same time have a diuretic effect. Together with 薏仁, 薏仁 in transforming dampness in your lung. We can even use 薏仁 to remove pus in our lung. It can become a very nice dessert for your dinner, or it can be a very good breakfast for the morning. We can also keep our body warm by doing standing meditations with the sun warming up our back. We know the 太阳 urinary bladder channel are traveling in the back of our body. It helps to eliminate the fluid in the body. At the same time, it also protects us from the external invasion. There's also one very simple exercise we can do if you already have the symptoms of chest pain and tightness. If you find any area that feel discomfort, you can just using your finger to tap on the area that you feel tight, or you can make an empty fist to pounding on the area that you already feel tight. We know that in the thalamus is where the T cells mature, and that is very crucial in targeting and destroying the pathogen. If we can press on the area where the sternum bone is and find any sore and achy spots, tap around this area. Also, you can use your finger to tap along your lung channels, and then that will help the circulation and qi movement in the lung channel. Moxibustion. We talk about burning the moxibustion to make our environment dry. At the same time, we also can use moxibustion to warm up acupuncture point to help the transforming of the dampness in our body. There's 2 points we can recommend. Number 1 is the REN 12. If you draw a straight line between your end of the sternum bone and your belly button, find the center, that is REN 12. This point is the best to transform the dampness, improve circulation in your digestion system. Stomach 36 is also a very good acupuncture point, which will help you to transform the dampness, improving your digestion to increase your immunity. There's also some very simple alternative therapies that we can do at home to do guasa in our back, and also we can use cupping in the back along the urinary bladder channel. Both methods can increase the movement of qi, eliminate the extra fluid that's being accumulated in the surrounding tissue. What is the best way to boost up your immunity? I cannot underscore enough the importance of the sleep in maintaining the healthy immune system. So please sleep before 11 and try to sleep at least 7 hours. There is really no substitute for good sleep when it comes to the health of your immune system. There is nothing you can eat, including supplements or herbal medicine, or do to make up your poor sleep. So sleep really needs to be a highest priority at this time. Talk to your TCM doctors if you have problems with sleep. The second is we have to reduce our stress. The body reacts to chronic stress is to produce more cortisol, which can result in accumulation of a fat tissue, which is also an indication of increasing of the dampness in our body. So the stress hormone, corticosteroid, can suppress the effectiveness of our immunity also. it lowers the number of the lymphocyte. So stress can also have an indirect effect on the immune system as a person may also using unhealthy behavior coping strategy to reduce their stress, such as drinking, smoking. So this is really bad for our immune system. Try to call your friends and a prayer or playing some music to reduce your stress. So if you do all these things we recommend, you will have a best condition to fight this battle. So what TCM can help in the 3 stages of disease. Stage 1, we can help the diseases before it happens. So we can help your body to prevent you to get COVID-19. And in stage 2, if you already have the COVID-19-like symptoms, we can prevent it to progress. And then in the 3rd stage, if you recovered from the COVID-19 and you still have symptoms of weakness, tiredness, and poor appetite and poor lung functions, we can help the patient to return to his best ultimate health condition. So if you have any question, please leave your comments, and then we will try our best to help you, and we really can fight this battle together. And please do not be stressed, because there's so many things you can do to help your body to recover itself. That's all for today. See you in the next video.